For the past 2 years, the fight against HIV and AIDS took a severe knock as attention mainly shifted to the COVID-19 pandemic. But it's been a turning point in Pretoria as the Global Fund has announced a massive cash injection to regain lost ground in the fights against HIV, AIDS, TB and malaria.
This is a major contribution to our fight against HIV, TB and malaria and sexually transmitted diseases. But you know, these are public funds because these funds are from donors. Some of the donors are governments, including our own government. As you would have heard that the US over the last 20 years have contributed just over 20 billion US dollars. France has contributed just over 8 billion US dollars.
In countries where the Global Fund invests, AIDS-related deaths have been reduced by 65% and new infections have also dramatically gone down. The National AIDS Council has also thrown its weight behind the additional resources, saying the fight against HIV and AIDS cannot be overlooked.
We've seen the coverage of medication that prevents mother-to-child transmission of HIV increased from 71% in 2010 to 95% in 2020. We've seen the success rate for treatment multi-drug resistant TB increasing from 40% to 60%. The number of HIV patients with TB who have access to ARVs increased from 54% to 85%.
The government has urged people who have not had their HIV and AIDS treatment since the outbreak of COVID-19 to approach healthcare facilities.
We want to say that it's safe. We've learned a lot. Even as I say, we never actually closed health facilities, but there are a lot of inconveniences in terms of how health facilities were organized at certain levels of high levels of COVID. But now we've had a lot of experience. We're making sure that the COVID work it does not interfere and people will not really end up standing too long.
The Global Fund's investment case for 2024-2026 estimates that the total funding needed for that period is over 130 billion US dollars to get the world back on track towards ending HIV, AIDS, malaria and TB by 2030. Khumalo, SABC News, Pretoria.